Hi everybody, my name is Callie Northagen. I am so glad you're with us. I'm joined by an amazing woman, Dr. Cheryl Duchess, who is a certified naturopathic doctor, a master herbalist. She changed my life. I've been on a mission for many years to be healthy. I saw my mom ail and get sick over the last 4 or 5 years, and I am so grateful to what you've taught me in regards to how to get to a place of optimal health. So first of all, thanks for being here.
Thank you.
Absolutely. One of the things that really upsets me is how many Americans are ill and how many Americans just automatically turn to prescription drugs. It's not a good choice.
Yeah, no. And by the time someone's 50, 60 years old, they're on sometimes 5, 6, 7 different medications that interact. And prescription drug overdose is now the leading cause of injury-related deaths. It's so risky. And yet people don't know which way to turn. There's just a lack of education, really.
It's true.
Because medications have a lot of what we call a downward cycle, because there's always a side effect because the body doesn't recognize them. They're synthetic. But when you do more natural things and you give the body what it needs and you feed nutrients into the body, then the body has a chance to actually heal itself. And that's the basic principles of naturopathy, which it just has helped so many people.
I know, you've been doing what you do for many, many years. And what we're here to do today is really educate everybody about a better way to get to a good place of optimal health. And so one of the things that I know changed my life several months ago was when I was introduced to Isotonix. And I really want to talk a little bit about each of the products so you guys can understand why this is a better choice for you, or maybe somebody that you care and love. And I certainly appreciate the fact that with so many deficiencies in our own American or Western diet, we all have good intentions. We try to buy organic, we make good choices, we think, but most people are, if you're taking supplements, you're taking capsules or tablets. And I've learned through you that they just don't digest in our systems the way Isotonix does.
Right. And it's just so true. In the InHane study showed in 2006 that people were deficient in vitamin E, vitamin D, calcium, magnesium, mineral deficiencies. And again, when you give the body what it needs, it's just like feeding fertilizer into a plant. It can flourish, okay? But I found out with supplementation that tablets, especially when you do multivitamin, minerals, those kind of thing, they don't easily break down. And even a good tablet, you might get 20, 30%. So I actually found this isotonic line when I was looking for IV therapy for patients, because when someone is very, very ill, again, giving them the right nutrients. So isotonics are totally different. They're powder, and when you mix them with water, they become the same osmolarity as your bodily fluids. And so the body doesn't have to digest it. It hits the stomach, you drink it on an empty stomach, and then you wait about 10-15 minutes after you've drank it before you eat anything. But the beautiful thing is the bioavailability is happening, because again, it's like almost like an IV of nutrients, okay? The absorption is there, much higher than a tablet would ever be.
Absolutely. And I feel frustrated that so many people are wasting so much money buying tablets that don't even get absorbed into the body. So they're giving us no benefit whatsoever.
Exactly.
And so thank you for addressing the delivery system, because that is the key to the Isotonix way of life. What we've got between us is actually a kit called the Daily Essentials, and they really work beautifully together in tandem to give our body a lot of the deficiencies that we're dealing with right now. Would you mind going through the kit with us?
Sure.
Maybe one at a time?
Absolutely.
There we go.
Let's start with the multivitamin. Well, multivitamin is so important because, again, as we just found out, we're deficient in C's, E's, beta-carotene, those kind of things. And a multivitamin gives you that base. But more importantly, the reason I always want a client or a patient on a multi is because the minerals, we're very mineral deficient, and without good minerals, you will have symptoms like, cramping of your legs, fatigue, even leading to, a lot of imbalances with your electrolytes. And so taking a multivitamin is one of the most important things, but doing it in tablet form is really like, especially putting minerals, is like asking your stomach to break up a rock. And so I love these. They taste great. And again, you just mix it with water. So a multivitamin is so important for that base.
Absolutely. That's one of the components of daily essentials. The other is calcium, which both men and women really need, but we don't need too much.
Right, exactly, exactly. And so again, this is isotonic, so it's ionized calcium. There's 5 different elemental calciums. And when you do a tablet calcium, many times people get nauseous because again, the stomach acid is trying to break it up. In isotonic, it's bioavailable. And because it's ionized, you're going to receive it. And I actually have worked with several patients over the years that had osteoporosis, and through Isotonix, through other things, we do calcium, we do vitamin D, we do some super antioxidants, I've seen actually osteoporosis reversed.
Wow.
And you only want about 300 to 375 milligrams in your calcium because that's what we can actually absorb at one time. So with this particular one, we do 1 in the morning and then 1 before you go to bed. The beautiful thing is calcium will help you sleep better, and a lot of people report they have less leg cramping and things like that. And so it's great. It's great for sleep, and it's great for muscle spasms and things
I've
like that.
definitely noticed that as a side benefit. So thank you for, and then activated B. This is one of my favorites as well.
Yeah. So many people are deficient in Bs, and you've heard the buzzword about adrenal fatigue.
Yes.
It's a hot topic right now,
I
right?
dealt with it several years ago.
Well, the thing is that our adrenals get exhausted when we're under a lot of stress, and we're very deficient in B vitamins because, again, we're not getting them from our food source. And the key now that is being researched is activated B. So B6, B12, and folic acid. Those are so critical, and without them, you'll have fatigue, even depression, a lot of attention deficit problems, things like that. You can't even absorb your carbohydrates, your fats, or your proteins without Bs, okay? And so again, B12, energy, we all know that, right? And so these are isotonic Bs, so they're going to go into the bloodstream really, really quickly. And I love it because they are, again, activated Bs, which means your body can absorb them. And a lot of people genetically aren't absorbing their Bs. And I've seen great results with people having energy, having a lot more focus, and they're just fantastic.
Amazing, amazing product. But my favorite of all is the OPC3, and I know I'm not alone. This has alone changed so many people's lives, and I've learned from you through this relationship how many people are dealing with illness because of inflammation, and so many things start with inflammation. And that's just the beginning. OPC3. Tell us about this.
Well, and I'm so glad you mentioned inflammation, because we look at the body naturopathically, we look at a couple of root causes of diseases, and having inflammation, chronic inflammation, can really lead you to diseases, serious ones like even cancer, okay? And so having a natural anti-inflammatory, all right, is what this is. And it's an antioxidant, and you probably heard the term antioxidant, and you know, like vitamin C is an antioxidant. Well, antioxidants basically fight free radical damage, and free radical damage is what causes aging, what causes us to have risk of cancer, what causes arthritis. So having a super antioxidant fights that for us. And so what's in this is basically there's grapeseed extract, pine bark extract, bilberry, and red wine extract, and they're all in this isotonic base. And so clinical studies have been done on these ingredients. You've heard of the term pycnogenol maybe, okay? And that's out of a pine bark out of France. And the clinical studies have been amazing as getting inflammation out. So when we talk about inflammation, you talk about things like headaches. You talk about things like arthritis. You talk about inflammatory even with the skin, okay? So one of the things that OPCs have been so strong to do is inflammation. So a lot of people that have the chronic arthritis, migraine, headaches, those stuff, they have noticed relief because of the anti-inflammatory effect.
Oh, and the stories and the testimonials are plentiful.
They really are. And then I want to interrupt you because I want to talk about the other thing. OPC is such a strong antioxidant that it processes in the body. And when we have problems with your skin, usually like things like psoriasis, acne, skin problems, naturopathically look at your liver, okay? That means you've got toxins in the liver. OPC is such a powerful antioxidant. When you take it, especially in a little bit of a higher dose, it flushes out the liver. And so people have reported major results with psoriasis and, you know, acne, and also collagen. And so major with helping us with our wrinkles, right, as we age. And I love it because anything that builds collagen is not only good for your joints, but it's good for our skin. Okay, joint pain is another one. People really with, you know, degraded joint problems have seen results because of the anti-inflammatory effect.
Absolutely amazing product. Now the kit is all 4 components that Dr. Cheryl just went through. This is something that is so easy to take. You put a capsule or 2 of each in a glass. You take this little cap off here. This is your water cap. Okay. Use this, okay? You pour the powder into the little top cap here, and we like to use our cups. We pour the powder into there, and then you fill the water mark right up to the amount of servings. So if you did 4 of these, you would fill it up to number 4, or 8 ounces of water. So 2 ounces of water for every capful of Isotonix. It's so easy. And for people who travel a lot or are really busy, there's another way of getting these supplements into your life through these packets, which are super convenient. They include every one of the components of the kit, the OPC3, the multivitamin, the activated B complex, and the calcium plus. So this is another really convenient way to get this into your life. Tell us a little.
One more thing.
Sure.
I wanted to just mention that so many people suffer with allergies.
Oh, right.
And I was absolutely amazed when I first started using this product line, and I had a lot of people with, you know, pretty serious diseases, and I was using great success, you know, with the product. But they come back like an arthritis patient, and they say, oh my gosh, I don't need my Claritin. Well, it's because this has such an amazing antihistamine effect. So those allergy sufferers, I want them to know that this really works.
Great point. Thank you for adding that.
And cardiovascular. Did I mention that? Well, again, #1 killer is heart disease, right? Okay. And so OPC was clinically studied to lower C-reactive proteins by 52%. That means that it helps with the inflammation inside of the arteries, all right? And it balances out the nitric oxide, so it opens the blood vessels up so you get better blood flow. And that's why there was a clinical study, again, on OPCs that showed it lowered both blood pressure, cholesterol, and blood sugar in a clinical trial by 10%.
Wow.
So again, that's why I'm so in love with this product line, because I've seen so many actual results so quickly with people. And again, I feel it's because of the absorption, that isotonic absorption.
I agree, and I think that's why myself and everybody else I've shared this with see such immediate benefits and feel so much better. And that's what it's all about. We have one chance on this earth, and we're in charge of our own health. Nobody else can do it for you. So there's a couple of ways that we'd love to invite you to try this. Get in touch with the person who sent you this video, and they can get you started on the kit or the individual packets or whatever interested you with this discussion tonight. I feel a personal commitment or passion to wanting to help people lead healthier lives.
Absolutely.
And I can't thank you enough, Dr. Cheryl, for sharing your knowledge and your expertise. You can see why I invited her to this video, because it really is something that is different than what is available in traditional retail stores. And we really want you to get started.
Yeah, it's really great. And you know, we've got one life to live. And if you're not at your peak, if you don't feel good, you can't do what you're really called to do in this life. And that's what is so important, is take responsibility for your health. And trust me, even if you eat organic, we're just not getting it from the food store. So it's really exciting to have something that can really help people.
Absolutely. We're excited.